It's awesome being here as your, I guess, maybe not the main event, but at least I get to be the opening act for the afternoon's festivities. I think it's going to be fantastic. This is really a crucial period of time for everything that is going on with AI and health around the world. And as much as I'm going to, I was asked to talk about international comparison, but here's the reality. Everybody is trying to do stuff, and nobody is actually doing it well at scale yet. And so a big part of what I thought would be the most important reflections for the audience today is, well, what are the things that people are doing around the world in order to actually bring this power of artificial intelligence and generative artificial intelligence to the critical field of health, possibly the world, the field that is most relevant for the world overall. There's a lot of things we can do with AI, but health is one of the rare areas where AI can bring value for individuals, for communities, and for the population as a whole. And this is where we need to unlock the power of AI for everyone. And the opportunity that we have in this space is that we have this massive treasure trove of data. 30% of the world's data, like the world's data, are in health. Health uses a tiny fraction of that data. So what I did in multiplying this through, 29% of the world's data assets, if we think this is a value, the world's data assets are unused. That seems criminal. That seems at minimum negligent, because we've invested time and energy and effort into collecting all of this information only for it to be locked away and unutilized. And the power and the value that we can get out of this, we've heard it through all the various innovations that we're talking about today and we're going to be hearing about later on this afternoon. So how do we meaningfully unlock that value while we are still making sure that we are affording the appropriate protections at the same time? But is the value from the health data that we need to unlock? As I heard from one woman in the UK, how do don't tell me how you're protecting my data. Tell me how you are using my data to improve my health services, improve the services for my community, while you're ensuring me that my data are protected. And I think both of those things are important to bring together. And a big part of this is the reflection that data are underpinning all of our artificial intelligence innovations. AI without data is like taps without water. Frankly, the taps are running dry. We've invested so much in our innovations and so little in an integrated infrastructure to make sure that the right data are available for the right people in the right place at the right time. And that is really where we are needing to go moving forward, is to strengthen our data foundations. And in that vein, we need to really focus on networks, because a big part of the challenge that we have is we have an obsession with investing in one to get one. We invest in a hospital to build a hospital. We need to be thinking about how do we invest to incent networks? How do we foster an environment, and forgive me for the term, of co-opetition, where we are cooperating on our foundations. All of our innovators are using common and consistent and interoperable standards, and then we compete on the features of what we build. This is frankly what happens in virtually every other industry. If we think of banking, there's a reason I can use a bank from anywhere in the world and get money out of my bank account. The reason why I can fly anywhere in the world conveniently. But in health, we tend to fragment our standards. We fragmented our data, and as a result, we can't get the exponential value out of the data. So we need to really think about how do we foster and encourage and incent the networks that are required for a broad, robust innovation economy. And in that innovation economy, we need to think about what are the areas where we need to invest. We tend to invest a lot of our time and energy in AI in the really fancy, great work we've been doing around diagnostic imaging. But the challenge that we have with that is the benefits of those innovations are received by a small portion of the population, a small portion of the time. And where I really think we need to be shifting our attention from an AI economy perspective is thinking about what are the innovations we can actually bring forward that meaningfully improve everybody's lives a little bit. We've all heard about provider burnout. Many providers are attributing the fact that they're burned out largely to the fact they've had digital innovations dropped on their desks without understanding how or why it operates. So investing in how do we improve the provider's experience with these digital tools and innovations and artificial intelligence, such as the doctor asking a generative AI agent, what questions should I have asked given the conversation you have just listened to? What are our opportunities in that space? Because that improves productivity for the doctor and improves the quality of the care experience for the doctor and the patient. What are those things that we can be building? Because if we do that, that generates a dividend. Because that capacity we create allows the health system to reinvest in addressing our health backlogs, addressing the health burnout issues we have with providers, and frankly, get to a place where we have better health experiences for both the patient and provider. I actually have a webinar that I'm running tomorrow where we're actually going to be talking about how AI medical associations, when we surveyed medical associations about their opinions about AI, they said, we are not worried about AI replacing us, but we are worried about AI being developed without us. And our further reflection is AI isn't going to replace doctors, but AI-enabled doctors will replace doctors who don't use AI. And so if we think about that as a paradigm, that is where we need to be shifting our attention towards. There's been a lot of work, and this is obviously an eye chart. You can't read that. But this is just to say, as much as lots of people are talking about, we need to agree on a set of principles around AI. I will tell you, the OECD published principles in 2019. And while there are many, many organizations that have published principles in the last 5 years, those principles largely all converge in the same set. We need to stop talking about principles. We need to accept the principles that have been written, and we need to start moving towards practical action. And those practical actions revolve around these 4 main areas. And these are the areas where governments are really starting to focus their energy and efforts going forward. Trust. I'm going to start with trust because this is all about a culture shift of our health systems from being a paper-based analog linear system to being a digitally enabled networked exponential system. And so in that system, we need to understand this is going to be foreign for a lot of doctors, foreign for a lot of health providers, foreign for a lot of the public. So how do we demonstrate trustworthiness? And how do you actually do that? You simply ask the people, what does it take for you to trust what I am doing? And then you listen to those requirements, you embed those requirements, and you have a conversation with them again to say, have I done enough? Involving the public, involving the providers in the development of these solutions is going to be critical. Within that, we need to build our capacities, not just our technical capacities in terms of infrastructure, cloud-based services, et cetera. It is also building our human capacities, the ability for doctors and nurses to actually leverage these tools and technologies that we have. How do we engage the patient communities and the public writ large to actually meaningfully engage with AI and feel empowered in their own care to reap the benefits of this going forward? How do we cooperate with each other in an effective way, leveraging the capabilities of each other, building on the capabilities of each other to develop better products for people in the long run? And how do we establish incentives and governance that actually encourages the building of networks, that encourages cooperation, and encourages safety and protection and use of all of these tools and technologies going forward? I'm at the end of my time. If people have questions, I will be up at the top of the desk, and I'm very happy to take any questions you guys may have there. And with all that said, thank you for your time and energy. Hope I've jazzed it up, and look forward to the afternoon.